Welcome to Abike's YouTube channel. My people, you are welcome. If you are Igbo, no. Let's talk about Lassa Fever then. This is dry season. From November to March, we call it Harmattan, we call it dry season. But it brings all manner of diseases with it. So, let's talk about Lassa Fever. How do you get Lassa Fever? You get it through rodent. Rodent is rat too. So for all you people, especially these are Ebonyi states, we like to dry rice, pepper on the roadside. By the time you put that dry food there, and the time you come back in the evening to pack it, rat and his village people have urinated and done some things on that food, and then you come and pack it and then you enter the house. And then when you get inside the house, you didn't even cover the thing again. Now, if the rats urinated on that food and you eat it without proper, even with people that like to drink let me use that one as an example. You will just pour water, and then drink. You're trying to cool off because it's dry season. You know that you're eating the urine. That's how the Lassa Fever gets into you. 2024, we've had 1,000 confirmed cases. And we've had more for this 2026. And it's claiming a lot of life. And this is something that is very preventable. So how do you prevent Lassa Fever? First of all, cover your food. Put it in a sealed container. And if you have cracks, holes in your house, seal it. Those people that you enter their house at night, you'll be hearing giddy 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 in the ceiling. Like people are fighting in the ceiling. And it's alright. Please fumigate your house. Keep your house clean. Cover these holes. Because during dry seasons, rats, there is no food in the forest, so they will come into their house. So that's why we're talking about these things today. Because whenever Abike goes into these villages for medical outreaches or for clinic, we have seen some cases that we have sent to the teaching hospital for follow-up. And these are preventable illnesses. So how do you know that you have Lassa Fever even when you get it? Lassa Fever causes bleeding and it gives you a very high fever. There, Lassa Fever. So fever, very high fever, bleeding and severe weakness. So if you suspect that you have that, just kukuma quickly go to the hospital. Not chemist, so go to the hospital and get treatment. Now, the next disease we'll talk about that is a very big one is meningitis. If you've heard the word lockjaw, because when you get to the severe cases, it will lock your jaw and you can't talk. That's meningitis. But the thing about meningitis is there is vaccine, which is part of childhood immunization vaccines that you can get. You can even get this at the health centers in your community. So meningitis is preventable. But for those that were not vaccinated, now if you get meningitis, if you suspect that you have it, again, go to the hospital. But what does meningitis do? It affects the brain and the spinal cord. And we all know that the brain and the spinal cord work together. Anything that affects these two things, is very serious. So this dry season is a very hot season for meningitis. So those of you that like to gather in a crowded room and you have the windows closed and the doors closed, meningitis can be breathing in there. So if you're in a crowded room, one of the things you can do is just to open the windows, have ventilation, cross ventilation. Don't be too many people in a room and then close the door because you said it's hot and it's dusty. So we've had outbreaks in Nigeria and we go through this every year in Nigeria. Why? Because Nigeria sits on what we call the meningitis belt. This meningitis belt now runs from Senegal, is 26 countries in a line that goes from the east to west. From Senegal to Ethiopia. So we always say, us that stay here in the southeast, it does not concern us because it's happening in the north. But guess what? People are traveling. So when somebody goes to the north and catches it and brings it here, you might get it. So meningitis is a very serious illness. And if you suspect that you have it, quickly go to the hospital and get the proper treatment. I did not say chemist. I did not say go to chemist and get drugs mixed. Just go to the hospital. The last disease is respiratory illnesses. These ones are dust-related illnesses. Now, let me start with myself, because I suffered through severe allergy, which is where the dust irritates my airway, my throat, and I've been doing like this all day. So, for me to reduce my risk of all these things, I wear mask if I'm in a dusty area. Then if you have asthma, people that have asthma, they know what I'm talking about. You have flare-ups. So during dry season, you get all these flare-ups because these bacteria now, or all these viruses, through dust, they will go and irritate your throat. So if you're asthmatic, use your inhaler or your nebulizer, that you call it, and hold it handy. So another thing is sore throat. It's very common during dry season. Sore throat, again, these are bacteria that enters in through your respiratory tract and then irritates your airway. So again, if you suspect that you have any of these things, get the right treatment and try to prevent them, because what we try to educate people here is to understand that prevention, we all know that prevention is better than cure, but prevention is also cheaper. So for all these dust-related illnesses, if you're traveling in a place that is very dusty, wear your mask or use hanky to cover your nose and your mouth. So those are the things you can do. And then hydrate. Drink water. Because as you're drinking water, you're helping your body and your immune system to fight some of these diseases. So these are some of the things we want to talk about today. Because when we go to these rural villages and we see these things, we use that opportunity to come and educate you, the public, so that you will understand and know the things that is happening. So that's all we have for you today. Thank you. Check back for more videos. Subscribe to our YouTube channel. Follow us on social media. All that information is right there below the video. Visit our website, www.abicaresfoundation.org, for more information. Thank you.